Hello everyone. Today I am going to cover the last part of the CNS examination, autonomic nervous system and the skull spine. So autonomic nervous system is divided into central and the peripheral ANS. In central ANS, structure which are included are the amygdala, mainly hypothalamus, and also role of basal forebrain, page in midbrain and spinal cord. Division of peripheral ANS is sympathetic, parasympathetic and the enteric part. Main function of the ANS, it controls the non-striated muscle of the viscera and also glandular function. Also it regulates the circulation, respiration, digestion, metabolism and the temperature. So autonomic nervous system is mainly for the maintenance of the vital function. So to examine the autonomic nervous system, first we should take the proper history, then we should measure all the vitals in supine and standing position. So we will measure the blood pressure, heart rate, then record the temperature, and there are various other cutaneous signs can be there because of this autoregulation. Respiratory abnormalities can be there, eye sign and abnormal body weight and appetite can be there because of involvement of the hypothalamus, may be having bulimia or behavior changes, sleep disturbance because of central ANS or hypothalamus involvement. So for a detailed history to rule out the autonomic nervous system dysregulation, in this first we have to ask the sign symptoms due to the dysfunction of GIT and GOT. Example, child may be having the constipation, dysphagia, night diarrhea, weight loss, or sometime urinary retention, urgency, recurrent UTI can be there, fecal or urinary incontinence can be there because of the GOT dysfunction. Then we have to ask the sign symptoms of the orthostatic hypotension. Child may be having the dizziness, lightheadedness, history of syncope, palpitation, weakness, confusion, slurred speech. All these symptoms will be worst when child is doing the exercise or after long standing, taking the hot bath or after meal. Also, we have to ask the history of related to the sweating abnormalities. Example, dryness of skin, lack of normal moisture in socks. It is characteristic. And after taking the detailed history, we have to rule out signs symptoms of ANS disorder. Then we have to measure the blood pressure and the heart rate. Orthostatic change in the heart rate and BP occur in ANS disorders. So we have to calculate the heart rate in supine and then in standing position. Then we have to measure the blood pressure in supine and at 1-3-5 minutes after standing. So normally systolic BP on standing should not decrease more than 20 mmHg and diastolic BP more than 10 mmHg. And in heart rate, normally it should not increase more than 30 beats per minute above the baseline on standing, or in adolescent age group should not be more than 120. Also we can perform the tilt table testing. In this we have to tilt the table up to the 60 to 80 degree angle, and after 5 minutes we have to take the heart rate and the blood pressure. So similar finding will be there if the child is having ANS disorder. Then we have to measure the temperature and we have to observe for various cutaneous signs. So patient will have the abnormal sweating or dryness, and it will also alter the temperature. Change in skin color or temperature can lead to the pallor, acrocyanosis, erythema. Sometimes mottling, hypertrichosis, nail thickening, all can be the feature of various cutaneous signs. Respiratory abnormalities in the form of hyperapnea, apnea, or various character of the breathing, biotes or Chinese stroke breathing can be there. In eyes, we have to assess the lacrimation by Sheamus test. We have to keep the strip of paper in lower eyelid, and after 5 minutes we have to measure the weightness in Sheamus test. And we have to also ask about the excessive dryness of the eye. Redness of the eye should be examined for the dryness and redness. If the child is having central autonomic nervous system involvement, hypothalamus involvement, then the abnormality of the body weight, appetite can occur. Child may be having the bulimia, behavior changes, child is having irritability or various behavior disorders. Sleep disturbance can be there in the form of hypersomnolence or insomnia. So all these are the characteristic testings and the symptoms of the autonomic nervous system. Now the last part, skull spine. In this we have to inspect and also palpate the skull for the size, shape, frontal bossing, prominence. We should palpate for the fontanelles and scalp swelling. Already I have explained the details in the general physical examination. So in this picture you can see the child is having hydrocephalus. And similarly for the spine, we have to inspect for any spinal deformity in the form of scoliosis, kyphosis or lordosis. Look for any swelling if it is present, either spina bifida or having the some other deformity. Then we have to palpate for the any tenderness or all the characteristic of the mass. So this is all about the autonomic nervous system examination and the skull spine. Thank you so much.